Arlena? It's 8 a.m., Kathy. Let me know.
We are ready, Dr. Patti.
Okay, thank you. Good morning. Good morning and welcome to the board and online viewers to the November 6, 2024 Board of Health meeting. The board meeting is officially called to order at 8 a.m. This virtual meeting is being streamed via Facebook and will also be rebroadcast on Facebook and YouTube. Regardless of how we felt about the outcome of the election, I just want to remind everybody, we are united because of our dedication for community health and well-being, and should keep that in the forefront of our minds. And we will continue to do the work we have been tasked to do. With that being said, let's begin today's meeting. Due to some time constraints in today's meeting, we will slightly modify our agenda. Arlana, do we have quorum? Let's see.
Yes, we do. Sorry.
Okay. With that in mind, the October Board of Health minutes were distributed to the board for their review prior to the meeting. Are there any discussions or amendments to the minutes?
This is Dr. Shah. Motion to approve.
May I have a second?
Ruth Carrico, I'll second.
We need a board member to call a second.
Second.
Thank you. Any opposed, please raise your hand. Any abstentions? So motion is approved as distributed. With the modification of our agenda, now we'll pass to Mayor's Office update. And now I yield the floor to Deputy Mayor Nicole George.
Good morning, everyone.
Good morning.
Good morning. Sorry, I can't be visible this morning and have to exit at 8:30. But just wanted to, thank everyone for their feedback on the mask ordinance. I know we had a really good meeting last week, hearing from community. I know that currently the council is debating options and looking at ways to strengthen the existing mask ordinance. So at this time, that's the only update that I have. Thank you.
Thank you very much, Deputy Mayor George, for that update. If you are not speaking, could you please mute your microphone? If you haven't watched the introduction to Kentucky's public health video recorded by Dr. Steven Stack, the Commissioner for Public Health for the Commonwealth of Kentucky, please do so. It gives a good overview of public health in Kentucky. This video has been distributed to board members, but if any member of our community advisory group wants to have and take a look, please let us know, and Miss Arlena will distribute them. The updated Metro Board of Health Orientation Manual was also distributed, and it contains lots of useful information for the role of the Board of Health member, and will provide helpful links, so please check it out. And we have also shared a survey monkey to find out the Board of Health members' disponibility to meet in person for December meeting. If you haven't filled it up, please do so. And just as Deputy Mayor George shared with us, we sent also our feedback to support the work that our mayor is doing regarding the control and the role of public health and gun violence. With that, we are going to pass into the perspective sessions, and we have uninvited today. We're going to talk about Louisville Metro Week program. We will have Jennifer Bowman, Maternal Health Child Health Administrator, Louisville Metro Public Health from Louisville Metro Public Health and Wellness. Jennifer leads the department's Week and Health Start program. She is a registered dietitian with more than 20 years of experience in public health, service delivery, and leadership. In the past 5 years, she coordinated efforts to help residents quarantine safely and receive resources for basic needs during COVID, assessed community needs to better understand the racial disparities in birth outcomes, and implemented process improvements to better serve clients and support staff. Her collaborations with community members, academic and nonprofit organizations help ensure that women, birthing people, infants, and young children receive the care and support they need to thrive. Jennifer was born and raised in Louisville, Kentucky, a true proud Louisvillian, and she completed her Bachelor of Science in Dietetics from the University of Kentucky. And she received in 2022 the Kentucky Public Health Association Peggy S. Kid Nutrition Award that recognizes a nutritionist for outstanding professional contributions and service in public health. Today, I present to you Jennifer Bowman. Ms. Bowman, you have 20 minutes. If you would like to share your presentation, you may do so at this time. I yield the floor to you.
Great. Thank you so much for having me here today to talk about our great WIC program at Louisville Metro. Can everyone see my slides? I just want to make sure that you can see my presentation. Great.
Yes.
Okay. So WIC is a federal pass-through grant funded by the USDA to provide supplemental food packages, health screenings, and nutrition education to low-income pregnant, breastfeeding, and postpartum women, infants, and children up to the age of 5. The primary goals of the program are to promote healthy birth outcomes, support early child development, and safeguard the health of at-risk individuals. In Kentucky, in order to qualify for the WIC program, you do have to live in the state of Kentucky, but you could live anywhere in the state of Kentucky. So just because you live in Oldham County doesn't mean you can't come to Jefferson County to receive your benefits. You could live anywhere in the state of Kentucky and receive it anywhere. You do have to fall in one of the categories, whether you be pregnant, postpartum, or breastfeeding, and or a child under the age of 5 or an infant. You also have to have an income below the 185% of poverty. It's a little hard to see this chart. I can send this to you guys separately too. But for a family of 4 currently, it's $57,720 annually to qualify. And those income ratios do change from year to year. So those are for 24-25. As of 2021, in the state of Kentucky, there are an estimated 180,011 eligible individuals. The state is currently serving 106,572 of those eligible, and that gives us a rate of approximately 59% coverage. And this is comparable, as you can see, to other states. I did pull out Vermont and California from the USDA site. As you can see, Vermont, although they have 71.6% coverage, they're only serving about 11,300 participants. And then California, we kind of look to them, and so does the USDA, because they are so large, as kind of a gold standard. And their coverage is 66.5%. So 59% really is a pretty decent coverage given the rest of the country. So in Louisville, WIC has 3 full-time sites. So we operate out of our Dixie, Newburgh, and L&N locations 5 days a week from 8 to 5. And then we also have a satellite site out of our South Jefferson neighborhood place that does 3 days per week. That's Tuesday, Wednesday, and Thursday. And then we also offer hospital enrollments at our U of L and Baptist Health locations. In Louisville, we're very lucky to have 2 additional WIC providers in our city. So the Novak Center also operates a program, and so does the Park Duval Health Center. As stated we do have in Louisville Metro, we serve approximately 14,000 participants currently, which, as you can tell, is down from about 17,000 during COVID. During the pandemic, the USDA put waivers in place to allow for remote certifications. This allowed for the entirety of the certification process to be completed over the phone with no physical presence needed in the clinics. This was termed the physical presence waiver. In addition, measures were also put in place to allow benefits to those individuals that were unable to be reached by phone or missed appointments. This increased participation significantly. However, it decreased the amount of actual education being provided to families. In August of 2023, those waivers were allowed to expire along with the national public health emergency. This led to a significant decrease in participation, as you can see here, over the next 3 months. In Louisville, we dropped down to approximately 11,800 participants. At that time, the state requested that the clinics be allowed to continue to issue benefits without med appointments, which we were granted by the USDA until 2026. At this time, participants are only required to come to clinic 1 time per year to continue to receive benefits. However, it is requested they come in for a mid-cert appointment, as we call it, to ensure that nutrition education is provided. All other follow-up appointments are completed over the phone. So as you can see, over the course of the last 4 or 5 months, we were able to bring that participation back up to around 14,000, where it remains. So by removing barriers, we have been able to improve our participation rate, which is the number of individuals participating versus enrolled. With this rate shows us that once enrolled, almost all are continuing to receive benefits. So in the WIC program, we have these 2 terms that we throw around quite frequently. We call it participation versus enrollment. Enrollment means that within that year, you have been certified into the program. Participation means that you are continuing to receive those benefits every 3 months. So as you can see, in August of 2024, our participation rate is almost back up to, I think it's right around 97%. But we did get down to in the 80% range in November and December of last year, which is definitely not something we want to see. In addition to the reduction of barriers from the USDA and state, we recognize the need to increase our outreach and created a position dedicated to this. In 2022, we hired an outreach coordinator to assist with educating partners and community about WIC and its benefits. Our coordinator currently attends approximately 4 events each month and has attended 40 events this last year. At these events, she schedules 3 to 8 appointments at our WIC locations to either enroll or re-enroll into the program. She also uses several tools from the state to assist with outreach, including the Medicaid report and our annual letters to physicians. So the Medicaid report, I'll dive a little bit more into this. That report is a great tool that is provided to us by the Medicaid staff team. And it gives us a list of all individuals that are enrolled in Medicaid but are not enrolled in WIC. And if an individual is enrolled in Medicaid and falls into our categories of pregnant, postpartum, breastfeeding, child under 5, then they are adjunctly eligible for our program. So we are able to reach out to those individuals by mail because we don't get phone numbers. But we are able to reach out to them and let them know that WIC is something that they are also eligible for. In addition, our outreach coordinator has also worked with our communications team to create social media rotations, newsletters, and we also were able to create a 50th anniversary video in the last year, which I've linked on the previous slide. Although we've made great strides to increase our reach to the community, our biggest barrier to increasing participation is our significant staffing turnover. We currently have 38 positions budgeted. However, only 24 of those are filled, leaving us with a 29% vacancy rate. State staffing standards recommend that we have a 1,000-to-1 ratio for staffing both nutritionists and support staff. Due to high turnover and rigorous training standards, it's hard to maintain these staffing levels. So I have this table here that shows the staffing component at each clinic currently. And actually, in the 2 weeks since I've created this presentation, these have changed again. We've had some more resignations come through. But as you can see by the staffing standards, our Newburgh clinic is the clinic that struggles probably the most with staffing. With 5,700 participants, they should really have they should have 6 nutritionists and 6 support staff. But as you can see, we can't keep individuals. That has our highest turnover rate, is that clinic. There are positions budgeted for that clinic. However, it's very hard to maintain those staffing ratios. At this time, our hiring process for Metro also creates barriers to filling these positions there's a lengthy hiring process. It's a long time from the time that people apply for positions to when they're hired. Again, high turnover rates, the training required. So typically a fully trained staff is between 4 to 6 months from date of hire. And then that also leads to low morale due to the lack of staff. And then these constant changes of staff turnover eventually will lead to burnout in both our staff and our leadership. So we have done some things to combat these changes. We've added, as I mentioned, we've added 7 positions in the last year, including a call center position, a floater, and a floater for each discipline. So 1 nutritionist floater and 1 support staff floater. At our quarterly meetings, staff are given team building activities to improve morale, and multiple trainings on staff burnout and self-help have also been provided as well. In addition, the WIC leadership added an anonymous comment box located on our SharePoint page to create a safe environment for all voices to be heard. There is also an advisory committee made up of support staff and nutritionists from each clinic that meets once a month with me to discuss concerns. Unfortunately, we continue to see turnover despite these efforts. It's not all bad though. I'm happy to report that even with our challenges, the amazing WIC team is resilient and continues to persevere and accomplish great things. In 2024, they have added the Baptist Health Hospital enrollment to our hospital enrollment. And we've also added, like I mentioned, multiple positions. And then we've also implemented the electronic health record, which allows us to be more mobile. And it also allows us to eliminate the need for paper. So given all these challenges, the WIC team continues to amaze me. They remain resilient and committed to serving the families in our community and empowering them to be able to provide nutritious food to their infants and children. I appreciate your time, and I am happy to answer any questions. Thank you so much for having me.
Thank you very much, Ms. Bowman. Are there any questions or comments for Ms. Bowman?
Can I ask one quick question? Ms. Bowman, thank you very much for this presentation. One quick question I had was, I know you mentioned about the sort of the physical space that patients have to come in and do the nutritional assessments. Is there any sort of look into doing telehealth for some of that? Because I'm sure it's probably a difficulty for folks that are working full time to essentially come in and take a day off.
Sure. So the USDA actually has put some parameters in place for that. There's really only one time per year that participants need to come to clinic now, and the rest of those appointments can be done via the phone.
Got it. Thank you.
Anybody else?
Dr. Single?
Yeah, I just wanted to say thank you, Jennifer. And it's such a wonderful program until you go there and witness what Jennifer does and what her team does. it's very hard to really comprehend the kind of work her team is doing. I strongly encourage that I'm sorry, Jennifer, I'm gonna put work on you. I strongly encourage that if you're interested, discuss with Jennifer, visit one of the clinics, visit what really is happening, and you'll see no matter what's happening in the world and in the politics and the religions and the races, there's good work being done every day by Jennifer and her team. And I'm so honored that I get to work with her.
Thank you, Dr. Single. Yes, and I will say, based on back to the physical presence, a lot of my team has expressed that it's really difficult because I started as a nutritionist in the WIC program. And, back then they had to come every 3 months, which I agree is a little overkill, but it does allow you to build relationships with participants. And that is part of what keeps them coming back and keeps them participating over the course of their child's time at WIC. And I have had multiple staff say that a lot of that has been lost with the current system. However, I also understand the need to kind of change with the times. People like remote type of appointments now. So we're trying to get that happy medium.
And I'm going to comment, I'm happy that the barrier of transportation has been, set aside, because it's not only for working parents, but also for those parents that don't have transportation. So allowing them to do this via phone changes their lives, and particularly their children's lives. And wearing my other hat, as a health empowerment coordinator with La Casita Center that works with the Spanish-speaking community, we have been working hard with WIC, helping, to put many of the material they have available in Spanish, available to at least this part of the community. And I'm sure many other communities with different languages are going to start working as well, coming on board with you. Anybody else, any more questions or comments for Ms. Bowman? Well, with that, thank you so much for coming and sharing and giving us, a clear idea. So in the state, we have approximately 59% of, of use of the program. What about in the county with that 14,000 people users?
So yes, so in the county right now, it's a little tricky to get that information. Felicia Pugh is one of our epidemiologists here, and she's amazing. And she tried to crunch those numbers for me, and she did come up with a rough estimate. So we're roughly eligible in the community is about 33,000. So we're serving 14, and then the two other agencies in the county service somewhere around 3,000 together. So roughly half are participating in the program.
So it's approximate for the county and for the state. Okay.
Yes.
Well,
yes.
Thank you very much. We appreciate your participation and your sharing of this important information with us and with the community. And now we will continue our agenda and allow time and space for our updates and reports. So this is for the director's update. Now I yield the floor to the Chief Health Strategist, Ms. Connie Mendel. Connie.
Good morning. Thank you. So I have something before the report exciting to share. So we received, on behalf of Dr. Patricia Batista-Cervera, our chair, a letter from Congress of the United States, the House of Representatives. So if please allow me to read it. It says, "Dear Dr. Patricia, I am writing to extend my congratulations on your recent appointment of chair of the Louisville Metro Board of Health. This is a reflection of your dedication, expertise, and unwavering commitment to the health and well-being of our community. Additionally, being the first Latina chair, it is an inspiration to many, showing the importance of representation and the powerful impact that diverse leadership can have on our city. Your leadership comes at a crucial time, and I am confident that your vision and experience will guide the Board of Health in making meaningful progress toward addressing public health challenges and ensuring that all members of our community have access to quality care. Please find enclosed a congressional certificate of recognition in honor of your outstanding contributions to public health and your commitment to serving the Louisville community. I wish you best in years to come. It is my privilege to serve you in the U.S. House of Representatives. Please let me know if I can ever be of assistance to you. Sincerely, the Honorable Morgan McGarvey. We will be sharing this with Dr. Patricia Batista-Severa, but wanted to share that also with our board members. So thank you.
Thank you so much. I'm humbled and I'm honored by this recognition. Thank you so much. Appreciate it. Thank you.
Congratulations.
Absolutely.
Thank you.
So with that, everyone should have a copy of the director's report from myself and Dr. Sengel. As always, a lot of things going on in the department. As Jennifer Bowman, our administrator, discussed, WIC, our Healthy Start program, is also partnering with some nutrition classes. So always great to work with our clients and serve them, trying to figure out ways to serve them better. It's not too late to get your flu vaccine if you haven't already done so, and updated COVID vaccines and RSV is also a great option, particularly if you have young ones or around people that have an immune system that could use a boost. So that information is there. Please go out and do so. With these warmer months, we continue to see some West Nile transmission, unfortunately, and mosquito activity. So our team is still working into November, but hopefully we'll get some colder weather and we'll be able to winterize and put the team down and to work all that equipment, and then they will transition to helping with other areas of the department like food inspections and facility inspections and that. But the last thing I'll share before I pass it on to Dr. Shingle is that asthma has been added to the health equity dashboard. So if you've not had a chance to check out the dashboard, please do so. A lot of just fantastic data and information. Please share that. And with asthma, our team will be working with Jefferson County Schools and trying to help some of those students who suffer from asthma, some of those that have the worst outcomes, and doing what we can on an individual family basis to prevent asthma. So from that, I will pass it on to Dr. Sengel.
Thank you, Carl.
There.
Thank you, members. Don't have much to add except just informing. Like Connie said, there's always much going on. We are working through our CHNA and Community Advisory Board meetings. We will come back to you once we have all the information and present to you. As soon as we do, I think it will be probably towards beginning of next year. And I don't think I have anything else to add, but if anyone has any questions, I'm open to answering those.
Thank you, Dr. Singal. Thank you, Ms. Mendel. Appreciate it. Now we pass to family health centers. Now I yield the floor to Dr. Bart Irwin. Dr. Irwin.
Yeah, thank you for the opportunity to report. One thing I wanted to mention that 2 weeks ago, Kentucky State University launched a mobile medical unit that will serve West Louisville. The medical unit will provide health screenings for health conditions that lead to heart disease like strokes and diabetes. The persons who are screened who have positive results will be referred to community health centers and other local medical providers for treatment. The mobile medical unit will also provide a food is medicine program that will educate West End residents on healthy diets and food preparation. So Kentucky State University will work closely with the local health department, Park DeVal and Family Health Centers to support the healthcare services for West End residents. That's all I had to report.
Thank you, Dr. Erwin. I don't think we have a representative from Jefferson County Public Schools.
Oh, okay. I was not aware of that.
So we'll go to the next. Greater Louisville Medical Society. Now I yield the floor to Dr. Anita Patia.
Okay. Good morning again, everybody. Thank you very much. I just wanted to update you all. First of all, as we all know, the Greater Louisville Medical Society aims basically to empower the physicians in the community, and that our mission is to promote the science and the art of the profession of medicine. And as a result of that, we are recently going to have a meeting at the Baptist Hospital where we are going to be recruiting more members. Our membership has to advance year and grow year after year. And even though there are as many more physicians joining Kentucky through the the medical licensure board, not many of them have actually joined here. So we're going to go ahead and introduce to them what our GLMS stands for and get more meaningful membership there. And then I wanted to update you that Dr. Hargett, who is the president of the GLMS, is planning a panel for the medical students on November 14th. And that's via Zoom. And he'll be moderating that panel regarding private practice in the modern era. As you know, it's really difficult for somebody to establish private practice here in Louisville, and people are struggling. And then, you know, with obstetricians and gynecologists being even more limited in what they can do, we're probably losing out. So this is going to be a great session where he'll be moderating that for the new medical students. Then the medical students themselves have asked the GLMS if they would be able to fund the resident and fellow section travel to the AMA meetings, and we have offered them some money there to help them represent us at the American Medical Association. I think KMA has also put in some money there, so we're very happy to help our youth represent them. I also wanted to thank Dr. Singler for this nice article that he wrote in the Louisville Magazine about transforming the power of health equity and comparing tomatoes and mangoes. And that was so profound. And I hope it reached the audience and they understood what the health equity can, you know, how we can transform the health equity here. So, and I also, prior to that, I think I've already thanked Connie Mendel for an article that she had published. In the January session of the magazine, we have, the theme is, sorry, it's going to be the December theme. It's called Roles of Medicine. And that basically talks about medicine beyond prescribing and treatment. So anything, whether you want to talk about preventing, which is such an important part of our medical practice. So I wanted to find out if anybody is willing to help me write an article on that. Please do contact me. I'd really appreciate that. And let's see, is there anything else? Oh, yes, there is a doctor's ball coming up on March 8th, where we're going to have, we haven't probably announced the location yet, or maybe we have. Actually, we have. I don't remember what it is, but that's the annual doctor's ball where we celebrate physicians in the field who have been outstanding contributors. And we also have a nice way to exchange a social evening and enjoy a social evening together. So we do like to invite everybody to come and join us in that this thing that doctor's ball. So please go to the website of GLMS and take a look at what it is that is being offered there and how you could all attend that ball. And that'll be all. Thank you very much.
Thank you, Dr. Batia. Now for the Kentucky Nurses Association, I yield the floor to Ms. Delanor Manson. Ms. Delanor, are you here?
I am here. Thank you very much, Dr. Patty. Good morning, everyone. We are really focused on the bill that we were able to get passed, violence in the workplace. That was HB 176. That was in 2023. The Cabinet for Health and Family Services was tasked to develop guidelines to provide for organizations that where healthcare providers work so that we could ensure that workplaces would be safe. That has not happened. So we've been working with Representative Nemus. He has written a letter to the Secretary Freelander, the Kentucky Nurses Association, and the Kentucky Organization of Nurse Leaders has also written a letter. We have not gotten a response. We could use some help, and that help would be in the form of contacting legislators to ask them to look into that. It is extremely important healthcare providers feel safe when they go to work. When you think about it, it is the only profession where being is accepted. That this bill was all about. So we could use the help. We could also use a letter from the Louisville Metro Board of Public Health to say, what is the progress on developing the guidelines to ensure safe working places for health? No, it impacts retention. It also impacts recruitment for healthcare providers. And this bill was not designed for nurses. It was designed to ensure safe workplaces for all healthcare providers. So if you can ask for support from the board, that would be wonderful.
Thank you, Ms. Manson. There's an invitation, so let's talk about this. For Greater Louisville Inc., do we have Ms. Shelby Somerville? No. Okay. So now we are gonna go to our committee report. For the Immunizations Advocacy Committee, Dr. Carrico, do you have anything to share with us? I yield the floor to you.
Thank you so very much. We continue to plot ahead on trying to make sure that there is some type of information available for our community for those who are interested in receiving vaccine. So I reached out to Jesse Sanders with the Kentucky Immunization Coalition, and they are developing a mapping process where you will be able then to have your clinic or your organization information on this map, and then it will be actually maintained by the coalition. But we'll be able to have information not only about where you are, but specifics about your type of clinic or your facility, what vaccines, what special accommodations do you have? So for example, if translator services are needed, or if it is related to school vaccination and additional parent consent is needed, they will be able then to put those specifics. So we have time set up to look at their prototype and work with their team that is putting this together. And I hope this will be a real jumping off board then for our local providers to be able to say, oh, here's a place then where I can get information out about my clinic. So I guess starting with something that is visible, that they can actually see what it looks like, may prompt some more engagement. So I'm happy that there is that work going on. So as we have that prototype, then we'll be able to start sharing that broadly.
Thank you so much, Dr. Carrico. And for healthcare coverage and outreach, now I yield the floor to Ashley Shoemaker. Ms. Shoemaker.
So right now is open enrollment for marketplace plans. So Kentuckians who are not eligible for Medicaid can purchase an insurance plan and receive a tax subsidy to help lower the cost. Open enrollment started November 1st and it continues through January 15th. Medicaid renewals for children are still on hold. at least until the beginning of 2025, and it may be extended until next June. So that is good news. It means that right now, children should not be losing Medicaid coverage, except for a few exceptions. And finally, we did receive one Medicaid update from the Department for Medicaid Services just yesterday. We learned that Anthem will no longer be a Medicaid managed care organization in Kentucky starting in January of 2025. So all of the Anthem Medicaid members will be reassigned to different managed care organizations. They will be reassigned to either Anthem, or I'm sorry, they will be assigned to United Healthcare or to Humana. Members will receive a notice. Sometime next week, they will send out a notice letting them know. And so there's nothing that members need to do. It will be an automatic process to get them switched to a different MCO. But once they've been switched to a different MCO, if they would like to change their MCO, they can do that at any time during the year. There is no longer a Medicaid open enrollment. So members can switch plans at any time during the year. Our next meeting will take place on December 9th at 4 o'clock.
Thank you for this information, Ms. Shoemaker. Is there any old business?
I just wanted to add to one more thing to the report that I had mentioned about GLMS. We do want to mention about the Foundation's physician wellness program that is being offered through GLMS for physician stress or physician burnout. So this is relevant to our wellness thing as well. So I just thought I must mention it here. And that's it. Thank you.
Thank you, Dr. Bhatia.
Dr. Batista, this is Dr. Shah. I had a quick question.
Yes, Dr. Shah.
Did Anthem Medicaid sort of give a reason as to why they were pulling out, and what does that do for the rest of the MCOs if they don't have the same penetration as Anthem Medicaid does?
So this was actually the result of a long-standing dispute over the managed care contracts with the state. So there was actually a lawsuit that has been several years in the making regarding this. Typically, Kentucky only has 5 MCOs, but because of this lawsuit over the contracts, for the past few years, we have had 6, and Anthem was one of the managed care organizations. The final result of the lawsuit was that the Medicaid contracts would stand as they were awarded, which means that Anthem was out as one of the MCOs. So it has nothing to do with Anthem's performance or quality in services. It was just a contract dispute.
That's helpful. And then what does it do for the patients, I guess, because I mean, there are 6 and 5, and I understand that they're going to get reassessed, but does that put an additional burden on the other 5 MCOs to say, hey, now you have to go cover where traditionally you might have pulled out?
Yes, yeah. So the other MCOs, I will say that all of the MCOs are available across the state. And so the state is reassigning the members to the 2 MCOs that have the lowest number of members to try to keep it even, try to even things up so that all of the MCOs have a comparable number of Medicaid members. But they are all available across the state.
Thank you very much.
Ashley, if a member chooses not to stay with one of the 2 MCOs, can they change?
Yes, they can change at any time. So if someone is enrolled in Anthem right now and they want to go ahead and change for December coverage, they can do that. Or once they're reassigned to one of these other MCOs, if they want to change from United or Humana to Aetna or Passport or WellCare, they can do that. They don't need any excuse or reason for it. They can just do it at any time.
Ms. Shoemaker, and this affects only Medicaid recipients. Is that right?
Yes, that is correct. Anthem will continue to offer marketplace plans, as well as other, commercial plans in Kentucky next year.
Thank you very much. Anybody else?
Dr. Batista, I would like to mention that we have about 6 nurses in the area. And the Kentucky Nurses Association recently implemented a food pantry because many nurses have food insecurity. And I know that sounds odd, but it does exist. In the last 2 weeks, we started the program 2 weeks ago, we've had 9 applications. That tells you that it is real. Most of them are seniors. Many of them are students, but basically, if you know of a nurse that is having food insecurity, if you'll let them know about our program, that would be great. The other thing is I want to encourage everyone to buy there's no healthcare without nurses license plate when you renew your licensure. Because $10 of that goes to our foundation that will help us with our food pantry. So consider. Thank you.
Thank you very much, Ms. Delanor. Could you please share all this information with Arlena so we can share it with all the board members and all the information regarding policies and everything else we are to call to do? Any other new businesses?
This is James Ransdell. I just had 2 requests or questions. Is the health equity data dashboard, is there a link in the report to get to, because I'm unfamiliar with it? And if there isn't, if it could be sent out to us, I would like to look at that. And then let's see, about the workplace violence. Is there anywhere to get specific information on that if we were to write a letter to our representatives, what would we reference and how would we respond to that?
Very much for that question. First of all, you're referencing HB 176 that was passed in the legislative session in 2023. I can provide information for Arlena so we can give you all the information that could be included in the letter. I can also include the letter that we wrote from the Kentucky Nurses Association that references those cases.
Oh, that would be phenomenal.
Thank you. I appreciate it.
Thank you very much. Yeah, thanks.
Dr. Ransdell, I'm sorry. Go ahead.
Oh, it was Connie. Go ahead.
Mhm.
I was just going to let you know, yeah, there is a link to the dashboard in the report, and then there's also one that's been placed in the chat.
Okay, super. Thank you.
That you just beat me to it, Connie. Thank you. And I think it's also included. It's part of the links that your updated Metro Board of Health orientation manual has. So if you haven't checked, just please go ahead, and we have the link now in our chat as Ms. Mendel shared with us. I want to thank everyone for taking time to participate in this month's meeting. The next meeting will be held on Wednesday, December 4th, 2024 at 8 a.m. This will be a hybrid meeting. It will depend on, the response and the answers we have had to our survey. We have a place already at the Louisville Metropolitan Health and Wellness Building. So we'll let you know all the details in futures emails, and Ms. Manson will share with us all her information that we will also distribute. And please note that the January 2025 Board of Health meeting will be moved to Wednesday, January 8th, and we'll send the information with the updated date. And if there is no further business, this meeting is officially adjourned. Any motions to adjourn?
I motion we adjourn.
We have both motions, first and second. Thank you very much. Have a beautiful day, and let's go and do our best, helping, accompanying, and working towards the well-being of the whole community. Thank you.
Adios.
Thank you, Dr. Patricia. Appreciate it.
Thank you.
Thank you.
Thank you, Dr. Renzel. Thank you.
Thank you. Thank you so much.
Thank you.